Is that better? Okay. Okay, we're live. Right, hi everyone. We're just waiting to see as you clock in. We're checking the laptop to see who's coming in here.
So bad at this. Oh my god.
Guys, we are technologically challenged in case you didn't pick that up. We're not as smooth and slick as the rest of the crew. But we are just waiting to see who comes up here on the group. Right, is anyone coming up here? Right, we can see a few of you coming on here. We're just trying to find us on the group here.
You're doing great.
We are, yeah. We are
You
getting there.
doing so well. Why don't you do this for professional?
Okay, right, we've got 15 people on. We're just trying to find ourselves here. It didn't seem to come up automatically. Right, see all. There we go. Okay. Right, so today we're going to be having quite an interesting discussion about understanding, do you want to fill here? Understanding training during pregnancy and postpartum. It's quite an interesting topic because we don't necessarily see a lot of pregnant ladies. We don't necessarily see a lot of people just after birth. But what we do see is the injuries that come on later down the line. So we have one or two that come during their pregnancy time, one or two of them that come during soon after the birth, but it's often for different reasons other than what we're going to explain to you when it comes to training. So today we're going to be talking about understanding training during pregnancy and postpartum. Firstly, I just want to say that in case no one knows, we're just physios. We're not medical doctors. We know that it's really important for you to understand that exercise is very unique for each individual. It's not only a pregnancy or postpartum issue, that what one can or can't do is very, very specific to you. The reason Adam is here, because I know it's Women's Month in August, the reason Adam is here is because it's important that the men in our community understand how our bodies work. And more importantly, Adam is a medical professional. And so he's going to be working with women down the line. And like I say, sometimes it's not related to the pregnancy immediately, but down the line. And if Adam doesn't know how to put the pieces of the puzzle together, then we are not really going to be getting the right input. So that's why Adam is here. And he sees a lot of these women. In fact, I think recently you've been seeing more pregnant women than I have. But we've been seeing a lot of athletes down the road that have had injuries that we can put back to something that happened during pregnancy or soon after. So what I suggest you do is I would definitely take a piece of paper. If you're planning to fall pregnant or you're going to your gynae soon because you are pregnant, I would definitely have these discussions with your doctor and make sure that your doctor, because he knows you the best and he knows your body, he knows what norm is prior to pregnancy, he knows what is normal during your pregnancy, or the risks of pregnancy for you. I think it's really important you sit down and have these conversations with your gynae or any medical professional that you happen to be seeing. So what we're going to start up with first is, Tam, can you please put up that graph? Great. So I don't want to get a whole long and complicated about the physiology with pregnancy, but I do want you to understand that there are many hormones that are moving around your body during pregnancy. And for those that are not pregnant anymore, they do actually linger in your body for up to 5 or 6 months after pregnancy. In fact, sometimes depending on how long you breastfeed for, some of these hormones are still floating around in your bloodstream. And with that, they can have certain effects on your musculoskeletal system. We're going to just take you through 6 of them. You're going to get confused because you're going to look at the graph and you're going to say, well, TJ, actually, there are only 5 on that graph. The last one, which Adam talks about, literally just happens for a very short period of time, right at the end, during labor, and afterwards, but Adam will discuss that. So the first one, if you look at, is that purple line, okay, HCG, human chorionic gonadotrophin. That is the one that picks up whether you're pregnant or not, okay? It's secreted by your placenta, and it's after implantation. So once that embryo has come out, it's been fertilized, and it's attached and implanted into your uterus, that hormone starts to kick in. And that is why it is used to determine pregnant or not pregnant. All right.
Cool. So the next one that I'm going to chat about is your progesterone, which is on the graph there, and it's either red or orange. I might be colorblind, so it might be different to you guys. All right. So your progesterone, it stimulates growth of blood vessels supplying the womb. All right. It inhibits contractions of the uterus so that it can grow for your baby. All right. So what you'll see when you're looking in the graph, as your baby grows, it is needed more in the body because it creates those blood vessels supplying the womb. So the more need for the child, the more need for that hormone in the body. It helps to strengthen the pelvic wall muscles for labor, and it also inhibits lactation during pregnancy.
All right, the next one is going to be your estrogen. Your estrogen is on the graph there, Adam, is it a green line? All right.
Green.
It helps the uterus grow as your baby is growing. It regulates and activates the production of the other hormones in the body. So it's a really, really key hormone. It works with progesterone to stimulate your breast growth and your milk duct development. Okay.
Next in line is your prolactin. All right, your prolactin is the blue line there. All right, and you'll see 3 of them, which look pretty similar with how they increase with the amounts in your body through pregnancy. Your prolactin is your main hormone for breast milk. All right, it enlarges your mammary glands in preparation for milk production towards the end of pregnancy and afterwards.
And then there's relaxin. Now, relaxin has a very similar kind of curvature on that graph. It's the one that sits under the HCG purple line, and it inhibits the uterus contracting prematurely. So it knows when it needs to drop off, when that oxytocin comes in, but up until that point, it actually prevents the uterus from contracting so that the baby can actually develop and your uterus doesn't respond to that growth. It also relaxes your blood vessels and increases your blood supply to your placenta, which is obviously to feed your baby, but also to your kidneys, because you're now getting rid of a whole lot of waste products that you need to in your body. So the kidney blood flow increases. And then the important thing to listen to here is relaxin, as its name suggests. It relaxes the joints of the foot, the ankle, the hip, the pelvis, even shoulders, and it also softens and lengthens the cervix in preparation for the birth process. It peaks, as you can see from that graph, somewhere between 6 and 12 weeks is at its max secretion.
All right, so the one that is not on there, so I don't have to worry about my color blindness here. So the one that's not on the graph is your oxytocin. All right, so it increases just before your labor, and the levels rise through your labor, stimulating contractions of your uterus muscles. All right, it triggers prostaglandins, which also increase your contractions. So this is what's used to induce labor if labor doesn't start naturally.
All right, thanks, T. So now we're going to talk about, so what are the effects of these hormones now on the mother's system? Okay, and I know when it comes to exercise, we're obviously more focused on the musculoskeletal, so muscles, joints, ligaments, that sort of thing. That's what we're more focused on. But I need you to understand that genetics or anything that you're predisposed to prior to falling pregnant can get exacerbated by pregnancy, okay, because there's a massive demand on your system. So, for example, some people only find out that they have a heart condition during pregnancy. Then, of course, males don't fall pregnant, but then with high exertional activities, they will find out they will have a heart condition. So underlying cardiovascular problems, even lung, pulmonary problems. Some people, eyesight. I've got a friend of mine that is blind, and with her pregnancy, unfortunately, she got more blind. She was partially sighted, and now she's more blind than she was since falling pregnancy and having her first child. Some people have rheumatoid arthritis in the family. Some people have ankylosing spondylitis within the family. And some people, you just have a slightly different curvature in your spine. And then when it comes to pregnancy, all these things get exacerbated. So please bear that in mind, that some of these things were pre-existing prior to you even falling pregnant. But one has to acknowledge them, and one has to try and embrace them and work with them through your exercise regime.
All right, so the next one with the effects on the mother system is your relaxin, and pretty self-explanatory. All right, it allows laxity of your pelvic joints for birth and plays a role in the collagen remodeling. All right, so let's just go to collagen remodeling, because sometimes that can be a little bit unknown. So collagen remodeling is just the basis of all tissue. All right, so a big kind of fad or a big kind of push in the nutrition market these days has been your collagen powder, all right, because it does just have a really nice big broad range of use. So your collagen remodeling is your basis of all tissue. So remember, the consequences of this can be quite long term, right, as it can be in the body for up to 5 months postpartum.
Okay, and then talking about that estrogen, which we saw as well, starts to gradually incline through the pregnancy. You must remember that during our normal menstrual cycle, there are certain parts in our menstrual cycle where these hormones also raise, elevate, and decrease, and elevate and decrease. And it has actually shown, they've proven that women are really prone to ligamentous injuries in their normal menstrual cycle when the estrogen levels are very, very high. So please take note that now, as your estrogen levels are increasing in your pregnancy, some of the ligamentous injuries in pregnancy and afterwards, because it takes a while to normalize, and then even if you're not pregnant or postpartum but having a normal cycle, you are at risk hugely when your estrogen levels are at their highest. And then estrogen also plays a role in that collagen synthesis. So there's a fiddle with the collagen synthesis, and collagen, as Adam said, is the basis for all tissue. So your body is very good at fixing things and healing things, but it will start with a collagen basis, and then from then it will develop further, whether it's bone, whether it's ligament, or whether it's tendon. The other thing that happens with this escalation of estrogen is it does unfortunately affect your power. It decreases your power and your performance. So it gets more difficult to get those really strong, high impact, maximal contractions of the muscles, because estrogen interferes with that. It doesn't allow that to happen. So that does decline.
All right. So going on, we got bone mineral density. All right. So there still needs to be a lot more understanding of this just in literature as in itself. But if we look at some of the studies, the one study shows that in pregnancy and non-breastfeeding women, bone mineral density is quite similar. All right. But breastfeeding mothers at 1, 3, 6, and 12 months postpartum were significantly decreased. And this can come down to, when you are breastfeeding, there needs to be a bigger output of your calcium levels for your milk. And so this can just cause a decrease in your calcium levels for the mother's own body to use.
All right, and then prolactin, it's very important for your milk production. It's very important to know that it can stay in your system. Now, the question is, how long does it stay in your system after birth, after pregnancy? Well, they say that from the moment you stop breastfeeding, it can still be in your system, because obviously in order for you to be breastfeeding, you've got to be producing prolactin, because that's for milk production. It can stay in your system for up to 6 months. And that's quite significant, because a lot of women, as soon as they stop, they've given birth and they're ready now to start losing, as they call, their baby fat, they get onto, they just get into running. It's still high load exercise postpartum. And with that, they're making their ligaments laxer and laxer and laxer. They also then lose milk production, because it affects the milk production, because the body goes, oh, I see you don't want to do that anymore. So it affects your milk production, but on top of it, it still is secreting prolactin, and that affects your joints in your body. So that can be a huge risk of injury. And again, it might not necessarily mean that your first pregnancy, you're going to pick this up. You might think, I don't even know what she's on about. I ran Comrade 6 weeks after my first pregnancy. It's with the accumulative and the repetition of 1 to 2 to 3 kids. And of course, getting back into some sort of exercise routine in between. Sometimes that never happens. And so the real exercise actually happened only 10 years ago. And that's where I'm saying we come in and we can pick up that there were problems. All right.
So we're going to go into the next section, all right? And this is exercise during and after pregnancy, okay? So everything is going to be different for everyone as an individual. So we give our opinions here, but if you will have different issues through your body, all right? And so these might change for each person specifically through their pregnancy or post-pregnancy, okay? So we get women coming in with issues during, we get women coming through with issues post as well. Just for instance, I mean, we get some people coming through and they are amazing during pregnancy. They have no issues. Sometimes they have back pain prior to pregnancy. Then they fall pregnant and they're actually feeling great during. So they actually find it a great time to get consistent with their exercise. And then by the time that they're postpartum, they actually have a bit of a fall down and start to have an increase in those symptoms afterwards. It might be the opposite way around, where some people come in with the pain during and then post actually feel a lot better as well. So this changes along for everyone as they go. Okay, so talking about exercise during and after pregnancy, pelvic floor is a big start. All right, it's really important. So training should start in women as soon as possible, right? And that can be guidance from your gynae, that can be guidance from your pelvic floor physio, that can be guidance through your Pilates instructor, wherever you find that you want to get your guidance and where you get your confidence and trust to follow that. That's where I would look first. You don't have to wait until pregnancy or after to start this, all right? And this is where even we go back to our stability system, or what we did in our first session where we did those exercise changes. Just connecting with your body first off is going to make a big difference. So starting stuff like this prior to falling pregnant, all right, is going to make it easier to take it through pregnancy and after. You connect your brain with the exercise, you connect to the exercise, and it just takes it easier to carry through and start up again post-pregnancy as well. All right. Abdominal muscle training is also important, but it is something that we do want to be a little bit more tentative of. All right. You must go under good instruction with this, whether it's your Pilates or your physio or whoever you're doing exercise with. Make sure that they do have a good understanding of this, because there are issues like your diastasis recti that can happen. All right. So we don't want to strain the abdominals too hard, but it is important to keep them firing and keep them functioning as we want them to. So postpartum rehab can be done to assist this, but if it does go on for too long, then surgery can be an option further down the line.
Okay, and so basically what it says, the general rule is moderate exercise. But again, moderate for me, moderate for Adam are vastly different. Moderate for some of my mates who are top athletes is also vastly different. And that's a very, very general term. So that's why I say you've got to be in contact with people that know you, know your body, your needs, what your norm is, whatever normal is right now. But they need to know what your normal, to then figure out what is considered moderate. Because starting an exercise regime just because you fall pregnant, because you're freaking out about losing or putting on weight and you don't want to keep your weight to a minimum, that's not advisable. In fact, that becomes quite high risk. In fact, people that are not active during their normal everyday life, when they then fall pregnant, they have a really bad thermoregulatory system. And that means that you can suffer, it's a relative term, it's hypothermia for the baby, because your thermoregulatory system is not great and you're expending a lot of energy in this freak out session of I don't want to put on weight. But in that first trimester it can be quite a devastation, because it affects the neural tube development of your new developing baby. So you don't want that. But what they have found is that women that were generally active individuals, they had a nice regular routine, exercise routine and structure before they fell pregnant, and then they maintained the moderate component of that during the pregnancy, they found that they had a really good thermoregulatory system. So it is important. I'm advocating that, Jono's platform is amazing. To have all that for 200 Rand a month is really, really incredible. I mean, I don't know any other platform that gives you that. So there's really no excuse to get into an exercise routine, to then maintain it while you're trying to fall pregnant, to then maintain it during pregnancy with all the adaptations that I think we've discussed. Injury, it doesn't have to be an injury. It can just be that you're pregnant and that your system is compromised, whether it's from an injury or from pregnancy. And then to have that at the other end of the day, then you can worry about one-on-ones and all that sort of stuff after you've given birth and got your body like normal and all that back. The other thing that you've got to remember is that the rules of exercise during pregnancy, we're going to reiterate, are purely dependent on what your exercise routine was before. We have to know what your norm is before you advocate what you can and cannot do during pregnancy or afterwards. Yeah, happy with that?
Yeah, I think it always, the nice thing is, like when we spoke about it 2 weeks ago, the stability and the mover system.
Yes.
You connect with that stability system. If there's pain and inflammation, things that switch it off, the easier you know how to get that switching back on, the more consistent you can be with that. The less your body connects with that and you've connected with that, the harder it is to do day to day. So it's just those small things, and consistency is the biggest thing, and just carrying it through the entire time.
No, totally agree. Okay, just to cut things down a little bit more specifically, because obviously one plans to have natural birth and then it doesn't. As I've realized that kids, from the moment they conceive, they dictate everything. From the moment, like when they're conceived and whether it maintains and when they arrive, it's completely out of our controls. One where we have to relinquish control if you're a control freak like myself. So I had 3 C-sections. So what you've got to understand with the Caesars is that your abdominal wall is cut. And that's one of your, if you look at your stability system like a box, the top of the box is your diaphragm. Your front of your box is your abdominal wall, and that's then being compromised if you've had Caesars. The back is all the fascia and important stabilizers on your back. And at the bottom is your pelvic floor. So for C-sections, we really want to get that pelvic floor and that abdominal activation going as soon as possible, because your wall has been compromised. And you can start it very simply just while you're breastfeeding, as long as you've been taught how to do that contraction correctly. Then starting with very gentle walks, because remember that now your lungs have to expand. They were very, very small and compact, and they're compressed into a much smaller space. They have to realign and drop down. Your diaphragm has to learn how to work maximally again, because it also gets inhibited. Your abdominal organs don't have this massive baby sitting in the middle. They've got to learn to drop and realign. So gentle walking, just getting your body moving, is wonderful and really, really good for you. I think we normally say at 6 to 8 weeks, depending on complications or no complications, wound healing and all that. Then we advocate that you get into some sort of formal Pilates or abdominal strengthening program. But until then, not. I know I strapped my Caesar scar and taped it. There was a technique that I used. I strapped it for a year, because the reason is that the scar is what you see on the surface, but you can still see redness for many months. And that redness is all the healing that's happening where you can't see, all those fascial layers deeper. And so by strapping it, as I went from jogging to running to sprinting to hockey to all those sports, I found that the demands on my abdominal wall changed. And so I needed that extra support. So just consider that as well in the healing process of your scar. And then, like I say, you will need a very general, systemic, well integrated, all over body program. And then you can worry about jogging and the jumping series and then the multi-directional exercise. I definitely wouldn't advocate any sort of swimming or aqua aerobics or water training until that scar has been cleared, it's sealed, there's no like wound, no something that's niggling, that's not healing properly. You definitely need to get that cleared by the doctor and be 100%. But that's also a great way to start, water jogging versus land jogging.
Yeah, so let's take a little step back to where we were at the start when we were talking about the hormones. So up to 6 months postpartum, you can be secreting your prolactin and your relaxin. So again, when you are getting back into your exercise, you want to make sure that each program or what you are doing is quite unique, because it's going to need some close monitoring by whoever is helping you out with it. So with these 2 hormones, and we talk about the ligament laxity that can happen with it, and they can be there for a long time post-birth. So what we've got to remember with this, and I think a good way to describe it is when people come in with ligament injuries to us, I'm not saying that you'll have an injury because you have these hormones in, but just for an instance, someone that does overstretch a ligament, we don't like it when they come in and this ligament is still nice and long. All right, we want them to come in when this ligament is nice and tight. So if you come in with a long ligament and it's been too long, it's hard for us to make that ligament shorter. All right, we can't shorten it ourselves. But when someone comes in with a very tight ligament, we can help them to try and make that a little bit looser. So when we're talking about these hormones that make your ligaments a little bit more lax, when people go into exercise too quickly, and their muscle system might not be working as much as they should, and they go in either too quickly or too high intensity into what they're doing, these ligaments can take too much strain, all right? And what that strain will cause is when tension gets applied onto them, a certain amount of stretching will start to happen. And if that happens regularly enough into a higher intensity, they're going to start to want to stay like that, all right? So there can be some long-term consequences with it. All right, so we've got to make sure that the activity that you are doing postpartum and during pregnancy is quite closely monitored, and you are thinking about what you're doing and why you are doing it. All right.
Okay, and then natural birth. I know there's this, I mean, I had the massive plan of having natural birth. I mean, we all do. We get told it's how our mothers did it and our ancestors and what. At no point did I know I wasn't going to feel contractions. So I went through a whole week of labor to then find out that I don't feel contractions, which most people say, well, that's bloody awesome, TJ, well done. You know, like, I think I would like a dose of that. The problem is I couldn't partake in the birth process. So it became a very high risk and nearly lost my son, because by the time we got into hospital to insist like something needed to be done, his heart rate was at 50. So, you know, you've got to make sure that you have a plan, but always have a backup option. And we know that Caesar isn't necessarily for some people, but not necessarily everybody's first choice. And we all go for natural. Please don't be disillusioned in thinking that natural birth doesn't have its difficulties too. You know, you might have your abdominals cut in a Caesar, okay, one side of the box, but that underneath part, the perineum, the area between your legs, the saddle area, as we call it, that area can have an episiotomy. That doesn't mean that you're any less risk with muscle activation down there. And that can really be a problem when scar formation and all that inhibits how those muscles contract. And very few people are actually in control of the pelvic floor muscles and can come in here with dysfunctional pelvic floors just with lower back pain. It doesn't need to be anything to do with pregnancy. So please be aware that even if you've had natural birth, yes, your abdominals haven't been sliced. I get that. But there is and can still be a perineal component to that. So there might still be caution. Don't put pressure on yourself. I don't know why I can't get going. There'll be a very valid reason for why you can't get going. And that's where you need those abdominal eye or your physio or your biokineticist who's really in tune with that side of health to be able to guide you back to your normal. And remember, you've had your abdominals cut, you've had your pelvic floor cut. There are new normals. And so you've got to learn to work with those. And it might take longer after every single pregnancy yet again if it never rectified itself correct in between pregnancies. Yeah. I want you to also be aware that there are physios that specialize in pelvic floors. We've got a very good friend of mine and a friend of mine that I studied with who's really gone into pelvic floor. And that can go from constipation to a pregnancy to even your natural birth. Individuals end up with a really prolapsed uteruses and prolapsed bladders and all sorts of things. So again, those are other complications that one doesn't foresee immediately with a natural birth. But there are specialist physios out there that do women's health specifically. I just obviously, and Adam and I come from an athletic point of view, so we've got to bump it up a little bit better to where our athletes are going back to. But there are pelvic floor physios and very specific Kegel exercises and all those sorts of things that can be done. But the truth is, the stronger it is before, the less likely it is wrong to go during, and the easier it is to reconnect and readjust and redefine those pathways post-pregnancy. Yeah. Okay, so let's have a look at some of our questions. I'm hoping you were able to write down your own questions for when you go to your own gynae, someone that knows your particular health to the T. But let's have a look and see if there's anyone that we can help with.
I'm just going up to the top.
We're going to go all the way.
I'm coming back down.
He's coming back down.
I went too high.
Okay, Georgie, Peter said something. What did Georgie say? Georgie, go up.
I'm going back up.
You're going back up.
I was down, but now I'm back up.
Yes, there we go, Georgie. It makes perfect sense. Georgie says, that's me. Back pain started with first pregnancy, and I'm still suffering 16 years later. Georgie, it can be fixed, by the way. It's really intense, high concentration. It's almost annoying exercise. And that's why we go, oh, geez, we're going back to the basics. Trust me, even your elitist athlete struggles with these exercises. You're not alone. They have another system, though, that they choose to cheat with. That's the only difference. And we actually find it more difficult to deal with them because now we've got to unteach their cheating pathway and then reteach. Whereas with some people that never had an alternative, it's way easier to start from the beginning.
Yeah, I mean, we've had some ladies come through, and it's a long process afterwards as well. It can be, depending on what's going on and what has possibly gone wrong. Not specifically because of birth, but anything that might come up afterwards. And it can take months. It really can, and it's just consistency. And the hard thing that we find is we have to drop it down to such a basic level to start off with. It's really frustrating for people. And so to just have that constant build up, that consistency through week to week, it does take a few months, but you can get there. You can really make a big difference, but time does play a big role with it. An interesting question here from Tracy. It's been 4 years since I've had my little one and still struggling with diastasis recti. Sorry, I'm just struggling with the scroller.
There we go.
Continue to ask whether I'm pregnant. Any advice about this matter?
So that was Tracy, right? So Tracy, yeah, that's a difficult one because it is 4 years down the line, but there must be a reason why you're not connecting. And as I said, we said in the talk that we might actually have to have the surgical intervention. What it doesn't change is that rehab that wasn't working to get it closed still needs to be done after the surgery. Otherwise, the surgery will just end up undoing itself.
Yeah.
There's a very correct way of activating your abdominals. And if you were training it and weren't incorrectly instructed in exacerbating the diastasis recti, then you're going to end up with bigger problems. But it definitely needs to be under instruction there, Tracy. I'm assuming you've seen someone about it, but it probably sounds 4 years down the line. Sounds like there might have to be a surgical intervention. Depends how separated and how long down the rectus abdominis muscle that separation is.
Zenith said I had a Caesar 4 months ago, and the back pain is worse compared to my other 3 normal births.
Yeah, that's right, Zenith. So that obviously there are 2 components to that. One, that your abdominals were cut, and your lower abdominals are a huge role in your lower back stability. The other is that you now so many more pregnancies down the line, and so your abdominals are actually become more and more insufficient as pregnancies go on. We never really have the same abdominals. And then it might mean that you didn't have your pelvic floor stitched in that post natural birth. So this really threw your system off as a whole. I wish you luck, but definitely get that contraction going and sorted.
And we got a cool comment down here at the bottom by Tammy Newman, who's also a physio, women's health physio. And she says, I wish more of my patients were given this information during pregnancy. Too many women do too much too soon and are given such poor advice. Well done for educating the women. It's so important. So, I mean, guys, there are people like Tammy out there, all right? Your women's health physios. Use them. They're amazing, all right? They can really make a massive difference in your life with these kinds of things. So really use the resources that you have around you as well. Get advice. It's always out there for you.
Thanks, Tammy. I appreciate that. And that's the reason why we thought this was so crucial to discuss, because it's only when our patients come in. One of my really good friends, she's tiny, really good athlete, and she's 3 pregnancies down, and she did her symphysis pubis. And I mean, it was very hard for her to comprehend when I had to sit down and draw the timeline for her to realize that it had just been consequential of these 3 pregnancies and getting back to running like the 30, 40 Ks that we were doing at the time. It looked great at the time and she felt good doing it, but the consequences are sometimes just mounding up, and then there's that cherry on the top. So Tammy, thanks for that. We just felt it's really crucial that women understand, because I don't know why the antenatal classes don't actually talk about it. All the gynaes, I'm not sure. But please, there are people like Tammy out there, utilize them.
Yeah. That's it.
Is that it? Okay, guys, listen, remember, please let Jeff know. We'll be back in 2 weeks, hopefully with some other exciting topic.
Mm-hmm.
We've had some requests, but we're really interested in what you want to learn about. We're here to educate you on what interests you. There's no point telling us educating you on what interests us. We'd love to know what interests you. Let the team know. Ask your one-on-one coaches. Like, hey, can they maybe do a talk on this? We definitively are not going to say we have all the answers. That's not what this is about. But we're very excited to try and help give you information that we can sit down with some of the top experts to get the information from. And we can give you examples because typically we've actually had to deal with this in our practice. So we wish you all the best. All the moms to be, the ones that have just become moms, it's an exciting time. Those little precious bundles. Hopefully Adam will have one soon. You know, you never know. So he's got to learn this stuff. But we wish you all the best and have a fabulous 2 weeks till we see you next time.
Thanks for joining,
Lots
guys.
of love. Bye.
Boom.